Another day, another outbreak. This time, it's the measles virus stealing headlines around the United States. But wait, how can we have a measles outbreak when there's a well established MMR vaccine? In this video, learn more about why the US is experiencing a measles outbreak, the safety and efficacy of the MMR vaccine, or measles, mumps, and rubella, and how you and your family members can stay safe and healthy. Now, why are more measles cases popping up? Great strides were made in measles prevention, and in 2000, it was declared eliminated in the country. This was achieved through rigorous vaccination efforts by both the medical community and cooperative parents. Through awareness and education, the public learned that the MMR vaccine is safe and effective, and together, we were able to prevent measles infection nationwide. However, currently the MMR vaccine coverage among kindergartners is below the 95% target, and in some communities lower, and it is steadily declining. Furthermore, we're seeing global measles activity increase, which means an infected person can bring it into the United States. These two factors are big reasons why the recent outbreak started. The drop in MMR vaccine rates is startling to say the least. It threatens to undo the remarkable progress we made at the turn of the millennium and could lead to widespread illness and death. So, how many cases of measles infection have been reported? How widespread are the measles cases? As of April 10th, 2025, the Centers for Disease Control and Prevention, or CDC, says that there are 712 confirmed cases reported. This does not include probable cases. The measles virus has been reported by local health departments across states including Alaska, Colorado, Georgia, Kansas, Michigan, New York, Texas, Vermont, and several others. Now, why aren't more people getting the MMR vaccine? COVID-19 brought out a serious and largely unfounded fear of vaccines. But why? While there are probably several factors at play, one big source of vaccine hesitancy is the spread of misinformation online. Social media platforms are rife with both fear mongering and the spread of false information about vaccine safety. Too often, people rely on rumors and clickbaity headlines rather than science when it comes to making important decisions about their health. Furthermore, some individuals turn to natural home remedies to prevent disease rather than vaccines that have been tested for decades and have been proven safe and effective. So, does the measles vaccine still work? None of this changes what science has found time and time again. The MMR vaccine works. Healthcare providers recommend 2 doses of the MMR vaccine. However, even 1 dose is 93% effective against measles, 72% effective against mumps, and 97% effective against rubella. With 2 doses, these numbers jump to 97% for measles, 86% for mumps, and getting fully vaccinated will protect you against the symptoms of measles, mumps, and rubella. Commonly with measles, a rash appears. A high fever is another symptom. The mumps can lead to swollen glands under the ears or jaw, as well as a fever. Rubella can cause a rash and fever as well. So, when should you get vaccinated against MMR? Typically, the first dose of the MMR vaccine is given to babies 12 to 15 months old. The second dose is given between 4 and 6 years of age. However, MMR vaccination isn't solely for babies and children. If an adult shows no evidence of immunity, they should get 1 or 2 doses administered at least 28 days apart. If you're arranging any international travel, plan to be fully vaccinated before you go. This is especially important if you plan to visit an area where there are current reports of outbreaks and a great chance of contracting measles. If you're in or near Las Vegas, E7 Health carries the MMR vaccine. You can book an appointment online in just a few clicks. But won't herd immunity eventually stop an outbreak? This topic was a big one during the COVID-19 pandemic. Once again, we saw just how damaging, deadly even, the spread of misinformation can be. First of all, many healthcare providers agree that waiting for herd immunity to provide widespread protection for unvaccinated people is incredibly unethical because it requires people to needlessly become sick and even die. Why do that when there's a measles vaccine? Second, this approach only works if the vast majority of a population is immune, and the best way to get there is through, you probably guessed it, getting vaccinated. So, how do you know if you've been exposed to measles? Everyone should be educated on the symptoms of a measles infection. These include a runny nose, coughing, fever, conjunctivitis, white spots on the inside of the mouth, ear infection, diarrhea, and a rash. If you notice any of these symptoms and think you may have been exposed to measles, it's vital that you stay away from friends and family members, avoid going out in public, and contact your healthcare provider immediately. Left untreated, measles can cause complications during pregnancy and even permanent brain damage. Other serious complications include pneumonia and subacute sclerosing panencephalitis, or SSPE, which is rare but fatal. Measles prevention is everyone's responsibility. The measles outbreak is a scary warning sign. We're going in the wrong direction. When it comes to getting vaccinated for contagious diseases, many individuals understandably argue that it's a personal choice, plain and simple. During the COVID-19 outbreak, workplace and school vaccine requirements were challenged, and vaccination became partly a political issue where people stopped listening to science. However, getting vaccinated isn't just a matter of keeping yourself healthy. You also do it to prevent transmission so that the people around you don't become sick either. The outbreak is about all of us. This is why it's a matter of public health and not merely personal choice. All individuals, unless otherwise advised by their healthcare provider, should get at least one dose of the MMR vaccine, if not two. Talk to your provider about getting vaccinated or book your appointment with E7 Health today.